Pneumonia. Pneumonia is an infection in one or both of the lungs caused by a variety of bacteria, viruses, and sometimes fungi. With pneumonia, the air sacs may fill with fluid or pus, causing symptoms such as a cough, fever, chills, and trouble breathing that can make it hard for the oxygen you breathe in to get into your bloodstream. Pneumococcal pneumonia is caused by bacteria called Streptococcus pneumoniae is also called pneumococcus. These bacteria can spread from person to person through coughing or close contact. Pneumonia is the single largest infectious cause of death in children worldwide and is a leading cause of hospitalization in both children and adults. Pneumonia is a form of acute respiratory infection that affects the lungs. The lungs are made up of small sacs called alveoli, which fill with air when a healthy person breathes. When an individual has pneumonia, the alveoli are filled with pus and fluid, which makes breathing painful and limits oxygen intake. Causes of pneumonia. Many germs can cause pneumonia. The most common are bacteria and viruses in the air we breathe. Pneumonia is classified according to the types of germs that cause it and where you got the infection. Identifying the cause of pneumonia can be an important step in getting the proper treatment. Types of pneumonia. Bacterial pneumonia. Streptococcus pneumoniae is the most common bacterial cause of pneumonia, but other bacteria can cause it too. Bacterial pneumonia can affect all ages. In a young, healthy person, these bacteria can live in the throat without causing any trouble. But if the body's immune system is weak, then the bacteria goes down into the lungs and causes the air sacs in the lungs get infected and inflamed. The air sacs fill up with fluid and cause pneumonia. This type of pneumonia can occur on its own or after a cold or the flu. It may affect one part of the lung, a condition called lobar pneumonia. Viral pneumonia. This type is caused by various viruses including the flu and is responsible for about one-third of all pneumonia cases. Viruses are the most common cause of pneumonia in children younger than 5 years. Hospital acquired pneumonia. Some people catch pneumonia during a hospital stay for another illness, especially people who are on ventilators are at increased risk for hospital acquired pneumonia. Community acquired pneumonia. Community acquired pneumonia is the most common type of pneumonia. This type of pneumonia occurs outside of a hospital or other healthcare facility. Long term healthcare acquired pneumonia. It's a bacterial infection that occurs in people who live in long term healthcare facilities or who receive care in nursing homes. Aspiration pneumonia. Aspiration is when solid food, liquids, or vomit go down the trachea and into the lungs instead of going down the esophagus and into the stomach. If a person can't cough up these substances, these particles remain in lung tissue and can become infected and pneumonia may develop. Risk factors. Anyone can get pneumonia. However, the following groups are at the highest risk. People over the age of 65 and infants under age 2. The weakening immune system of older people makes them less able to fight off illnesses. Similarly, the immune system of infants is still developing, hence making them more susceptible to infection. Medical conditions such as chronic lung diseases, COPD, bronchiectasis, cystic fibrosis that make the lungs more vulnerable. Other serious chronic illnesses such as heart disease, diabetes, and sickle cell disease, and a weakened immune system due to HIV, an organ transplant recipient, a person on chemotherapy or long term steroid use, autoimmune disease is at higher risk. Exposure to certain chemicals, pollutants, or toxic fumes, these contaminants weaken lung function and make it easier to develop a lung infection. Pregnancy increases the risk of developing pneumonia. This is due to the immune system of a mother not working at full strength because the body is working harder to support the growth of the baby. Stroke, dementia, Parkinson's disease, or other neurological conditions can result in aspiration of food, vomit, or saliva into the lungs that then becomes infected. Cigarette smoking, drug and alcohol abuse, which damages the lungs and increase the risk of aspiration pneumonia. Symptoms. The symptoms of pneumonia are caused by inflammation of the lungs due to infection or irritation. The lungs produce excessive amounts of thick phlegm which must be coughed up in order to keep the airways open for effective breathing. Pneumonia symptoms can vary from so mild to so severe that hospitalization is required. How a person's body responds to pneumonia depends on the type of germ causing the infection, age, and his overall health. Mild signs and symptoms often are similar to those of a cold or flu, but they last longer. Bacterial pneumonia, which is the most common form, tends to be more serious than other types of pneumonia with symptoms that require medical care. The symptoms of bacterial pneumonia can develop gradually or suddenly. Symptoms include fever, chills, trouble breathing or shortness of breath, tiredness, profuse sweating, cough, which may produce greenish yellow or even bloody mucus, sharp chest pain, especially with coughing or deep breathing, loss of appetite, rapid breathing and heart rate, lips and fingernails turning blue, and confused mental state or delirium, especially in older people. The symptoms of viral pneumonia usually develop over a period of several days. Early symptoms are similar to influenza symptoms, such as fever, dry cough, chills, headache, muscle pain, and weakness. Within a day or two, the symptoms typically get worse with increasing cough, sore throat, loss of appetite. There may be a high fever and shortness of breath. Wheezing is more common in viral infections. Newborns and infants may not show any sign of the infection, or they may vomit, have a fever and cough, appear restless or tired, or have difficulty breathing and eating. Diagnosis: pneumonia can often be diagnosed with a thorough history and physical exam. The doctor will start by asking about the medical history and doing a physical exam, including listening to client's lungs with a stethoscope to check for abnormal crackling sound that suggests pneumonia. To help figure out if the infection is caused by bacteria, viruses, or fungi, the client may be asked some questions about possible exposures. The following tests may be used to confirm the diagnosis: chest x ray to look for the location and extent of inflammation in the lungs, blood tests to confirm the infection and to try to identify the germ that is causing the illness, sputum test, a sample of mucus taken after a deep cough to look for the source of the infection. A CT scan shows detailed images of any part of the body, including the bones, muscles, and organs. CT scans are more detailed than regular X rays. Pneumonia can prevent the lungs from moving enough oxygen into the bloodstream, hence, pulse oximetry helps to measure the oxygen level in the blood. Arterial blood gas test to measure the amount of oxygen in a blood sample taken from an artery, usually in the wrist. Bronchoscopy, a procedure used to look into the lungs airways using a flexible tube. It helps to evaluate and diagnose lung problems, assess blockages, and take out samples of tissue or fluid for testing. Pleural fluid culture. A fluid sample is taken by putting a needle between the ribs from the pleural area and analyzed to help determine the type of infection. Most of the time, pneumonia is treated at home, but severe cases may be treated in the hospital. If you like this video, please give this video a like, share it with your friends, and don't forget to click the subscribe button to enjoy more such videos. Thanks a lot for watching this video. Bye bye.